After being a staff member in Rocky for over 20 years, expanding cardiac services to me is the next step in us providing great care for Central Queenslanders and being a place of excellence where we can treat our own at home. About 7 years ago, I was a 38-year-old working in the hospital, and I had a rather significant cardiac event. After a fair bit of testing, it was found that I had some major occlusions in my heart. I had what they call blockages in my RCA, or right main coronary artery, and LAD, left anterior descending, that were both at about 95 to 99% occlusion, which basically meant I didn't have appropriate blood flow to my heart. At the time I was told it was called a widowmaker because you didn't know it was coming, and the chances of surviving if you had a major heart attack were slim. At the time it was an emergency. I couldn't take my family with me, which had 3 young children, one of which was a baby, and my wife stayed at home to look after them, so it was quite scary. Had an angiogram at Royal Brisbane where they actually put a catheter in either through your arm or through your groin, and then inject up a sheath and put in dye, and can actually take a picture of your heart and see where the blood's flowing, for want of a better word, which showed I had as bad as they thought. And then I got transferred to Prince Charles to have double bypass surgery done. Since then, in the last 7 years, I think I've gone to Brisbane probably 4 to 5 times for angiography, with continuing chest pain and bits and pieces part of the follow-up. I've had to, on each of those occasions, they haven't been planned, they've been emergency, and so I've had to go RFDS again, so I've got a quite intricate knowledge of those small planes. And I've had to go down and have stents put in, and just basic, imaging to see what's going on in my heart. The angiography I've had since, some of them were just to try and find out what the problems were post-bypass, and the most recent one I went back down to Brisbane privately for the same reason as I couldn't get treated at home, and I needed to know what was going on for my own work-life balance, and they found there was something they could stent. Which is actually doing the angiography and then putting in a sheath to keep everything open or reopen stuff. Since then, awesome. But I've done a lot of travel. I've spent a lot of time in Brisbane, and I spent a lot of time by myself, which isn't what I choose to do. For me, if I didn't have to travel to Brisbane, I would have had my family with me, which would have made a big difference. I was sitting in a bed by myself, 800 kilometres from home, not quite sure, especially in the first instance, if I was going to live, and not able to tell my family the same thing. So that was quite distressing, and every other time since has been similar, but we became a little bit used to it, which had its good and bad points. It's still very lonely when you're not well and you're not sure what's going to happen. Doing it by phone isn't the same as having your wife sitting there, maybe holding your hand or telling you it's okay, and talking to your kids on the phone to tell them Daddy's going to be home soon. It isn't fun, and that's not how you want to do things. Expanding cardiac services at Rockhampton Hospital would mean, if it was me, that I could actually be treated with my family support with me. It's not just about cutting to cure, it's about having your support services there so your mind, body and soul are looked after, which is just as important in that healing process, and the rehabilitation afterwards. You want everyone to be on board, you want everyone to be involved, and that's how it should be.